Our final speaker, and then we'll have some discussion and questions, is Yoav Mintz. Yoav has been asked to talk about notes 10 years hence, and I can think of no more appropriate person given his incredible track record of innovation. Yoav.
Thank you, David and Dr. Rao, for allowing me to share with you my vision of the future.
How is he?
Severe heart damage, signs of congestion in both lungs, evidence of massive circulatory collapse.
Well, we're not there yet, but we're making good progress. The 8 fundamental barriers that were identified by the original NOSCAR working group are actually heavily based on technological innovation, but we have already met most of those challenges. Access to the peritoneum, gastric closure, suturing and anastomotic devices have already been developed, and several are clinical already. Multitasking platforms are already emerged pretty quickly, actually. Several clinically, several are very promising, but the ultimate platform in mind would be one with robotic assistance that will enable integration of movements and be performed by a single surgeon. Maintenance of spatial orientation was actually easily solved by imaging software and motion estimation algorithms, or by simply having a visual scope that is not related in its orientation to the orientation of the nodes platform. The next generation of maintenance of spatial orientation will be miniature cameras that will be placed in strategic places in the abdomen, therefore separating our eyes from our hands. And technology today can offer cameras as small as 2.5 millimeters in diameter with 4 times HD resolution, making it possible to place these cameras far away from the target, and even having this digital zooming, we will still have HD resolution. And these cameras can be positioned into the abdominal wall either by magnetic attraction, like in the MAG system, or even mounted on a magnetically levitated platform that can hover in this peritoneal space and reach every point of the target from any angle without being confined to the instruments or to the place of insertion. So basically, we can say that technology is not an obstacle for notes. However, is this enough to make notes an attractive option for the next decade? Probably not, but the reason that notes will have a significant role is the general trend in general surgery to downsize and to minimize the extent of the surgery. So next decade, the surgery will not only be minimally invasive, but also minimalistic, meaning that the operation will be more targeted, less extensive, more organ preserving, and more functional preserving. And this trend began actually in the previous decade when radical mastectomy was replaced by modified radical mastectomy in axillary lymph node dissection, and today with lumpectomy and sentinel lymph node biopsy. Other examples are routine splenectomy for splenic trauma that was replaced for non-operative management. And meaningful improvements in chemotherapy allowed us to downsize the tumors prior to surgery and perform a more preserving, functional preserving and organ preserving surgery. This trend continues today also in a sentinel lymph node biopsy for early stage colon cancer, which allows us to perform a segmental resection rather than a huge mesentery resection, thereby preserving a better blood supply to the anastomosis and avoiding inadvertent adjacent organ injury, avoiding the consequences of high ligations of vessels. And it will reach to these goals of this decade of having minimally invasive surgery and also maximally preserving surgery. And I'll show you in the next few slides a few concepts of how the notes platform will fit in this trend. So gene therapy is a powerful therapeutic concept, but rather concentrating on dealing with targeting or replacing defective genes in the cell's nuclei, there's a new family of drugs called siRNA. These drugs actually block the product of the oncogenes, thereby blocking the sequence of events that cause the cells to be a cancer cell. And this is, for example, mice with pancreatic carcinoma, which were implanted with capsule of a slow-release siRNA specific to pancreatic cancer. And you can see that following 30 days, the tumor is almost gone. The major challenge, however, in gene therapy, like I said earlier, is drug delivery. And this is where NOTES comes in. Rather than dealing with difficult molecular mechanisms, we will use the NOTES platform to implant directly into the tumor capsules of siRNA drugs specific to those tumors. This has already been proven in animal models, and hopefully this year is going to human trials in carcinoma of the pancreas. Laser tissue welding is not a new concept, but it failed due to uncontrolled excessive heating of the tissues that wanted to be bonded. So the new, the new term is laser soldering, and the difference here is the addition of albumin as natural glue. So you heat up the albumin, and you control this, the heating process by infrared fibers, and then you receive a better bonding, and this really works. So human skin incisions are already being bonded by laser. Animal studies on small bowel and urinary bladders and on ureters are very successful. This is a very simple technique, and it's faster than any suturing mechanism. So this may turn up to be the new platform for NOTES anastomosis. And we have novel waveguides that we can deliver high energy CO2 power through these fibers, therefore enabling us to have flexible instruments with laser, and modifying the amount of energy going through these fibers. We can decide if to cut and coagulate or to perform a bonding of tissues. And these fibers can be even passed through a 1 millimeter working channel integrated into a miniature camera complex, thereby achieving our new NOTES tool. And other concepts that will allow us to minimize the extent of surgery are those who will enhance our anatomical vision and provide a real-time anatomical map. So for example, this is indocyanine green injection. We injected IV and we visualized the vessels pretty well. This is, however, a temporary effect of about 10 to 15 seconds. Infrared imaging displays the arteries because they are warmer than their surroundings, and this is not a temporary, this is a continuous effect. Nothing needs to be injected. However, it does have a limited depth penetration. You can see here the cystic artery and its bifurcation. And once we acquire both images at the same time, we can then overlay the infrared image on the standard image or only the required temperature range, and actually achieve something like an intraoperative true time vessel map. Another concept is fluorescent tumor imaging. We're nearing the point that we can tag cancer cells with fluorescent antibodies, and this is an example of mice which have pancreatic cancer with fluorescent tumors and you can see that we can visualize very small metastases when they fluoresce. This is an example of pancreatic cancer in a mouse. We illuminate the cavity with blue light spectrum, use a specific filter, and we eliminate everything but the tumor. And now with a simulation here of a simple Photoshop simulation, we can imagine that we will exactly know where the borders of the tumor are, and possibly also the involved lymph nodes. So, meaning that we can perform surgery rather than having to do a large resection. We will have our vessel map, and we will have our tumor map, and we can actually perform an intraoperative tumor staging rather than necessitating even to have a sentinel lymph node biopsy and then perform a simple segmental resection. So notes will be a part of our future in several arenas, in cancer, EMR for early GI cancer, in tumor staging, local drug delivery, siRNA, as for unresectable tumors or even a pre-resectional procedure. Bariatric procedure are already being done, endoluminal bypass and revisions. Endoluminal fundoplication for GERD has already been done, as we heard. Transesophageal myotomy is already being done in Japan and UC San Diego for achalasia. But the highlight in my mind for notes will be some kind of a endoluminal gastric bypass for diabetes, or a local drug insertion for diseases other than cancer, like inflammatory bowel disease. So if we take a look at what happened to laparoscopy more than 20 years ago, we can see that 3 years already after the introduction of laparoscopy, 70% of the cholecystectomies were already done laparoscopically, even though at that time we were still struggling with the higher morbidity rate of this procedure. And the factors that drive the adoption of the surgical adoption of innovation is actually a patient demand for the technology, low cost to the surgeon for the learning period, manufacturers' aggressive promotion, and benefits perceived by the stakeholders. Unfortunately, and like a slap in the face for the medical profession, patient outcome and patient benefit is not one of those factors. So it's up to us, the physicians who deal with notes, to make sure that once notes is fully clinical, it will be as integrated as it can, so patients will be eventually benefit from this procedure. Thank you.